Hi, I'm Dr. Jeffrey Antimarino. I'm a board-certified plastic surgeon and the founder of Bellissimo Plastic Surgery and Medi-Spa here in Pittsburgh, Pennsylvania. And we thought it'd be kind of fun as we move into spring and then later into the summer months to talk about one of the most popular procedures during this time, and that's liposuction. My wife Ella is here, and she's going to help us get kind of through this question and answer period. All of our viewers that have questions will be happy to answer those at the end of the broadcast. I'm going to turn it over to Ella now.
Can you please give us a explanation of what liposuction is?
I think the best way to start that is to tell you what it isn't. I think one of the biggest myths about liposuction is that people think it's a weight loss program, and it really isn't. Think about liposuction as a contouring mechanism and nothing more than that. So it's really a way for a surgeon to help a patient correct areas of resistant or family-derived fatty tissue that we have, that goes passed through generations. And we all have areas like on the outside of our hips and love handles that we just can't get rid of no matter what we do. So these are the areas that are targeted by liposuction, so we can help control those. So that's really what it is. The nice thing about it is you can handle that through very small incisions, and we use a hollow cannula just to aspirate that tissue, and then it's gone.
When I'm looking into having the procedure done, what qualifications would I look for in a surgeon?
I think first and foremost, just like any other surgery that you want to look into, you want to make sure that in this case it's a board-certified plastic surgeon that you're going to go see, or multiple plastic surgeons that you want to have consultations with. It's always nice to have at least 2 or 3 different opinions. I think it would be beneficial to find out if your plastic surgeon is part of the Aesthetic Plastic Surgery Society. That's usually a plastic surgeon who has had more training and more experience in cosmetic surgery, so they have more experience. And lastly, I can tell you, when I started learning, and a lot of people watch it on TV or watch it on YouTube, and patients tell me that the day before their surgery with me, they've watched it, and it does look pretty easy. But remember, those people that you're watching have been trained to do it. But I can tell you that there is a steep learning curve to liposuction because it's done by feel, and as the surgeon, you have to get comfortable knowing where exactly that cannula is in the depth, just under the skin, where in the fat pad it lies, and so that you're careful to take out enough tissue and not too much tissue, not going too deep, not leaving contour deformities. So it really is something that you need to make sure your surgeon has experience doing this procedure. And feel free to ask them that. How long have you been doing liposuction? How many cases do you do a year? Because of all surgeries, this really does need a lot of experience.
Who is the ideal candidate for liposuction?
I think liposuction is something that can help treat a lot of different things in a lot of different patients of all ages. That being said, the patient needs to be healthy otherwise and in good physiology. But the ideal candidate, I guess, that we talk about is somebody probably in their 20s, 30s, and even in their early 40s that has a little bit of fat deposits in areas that are resistant to diet and exercise. Most of the time we want the patients to be within 10 to 15 pounds of their ideal body weight. We want them to have good skin tone because, as we'll get into with liposuction is just removing that fat, and you're relying on the elastic properties of the skin to sort of redrape or stretch back and take up that extra skin, so to speak. So you want somebody whose skin isn't thinned out or is lost a lot of weight, so that skin has been stretched out for long periods of time. So those are the ideal candidates. But that being said, lots of times patients will come to me who have resistant fatty areas even after bariatric surgery, and all they want to do is debulk the area knowing that they're going to have some extra skin. But the problem is they can't wear the clothing that they want to wear, so we kind of remove the fatty areas knowing they're going to have a little extra skin, but be okay with that.
How would you prepare for liposuction? How would a patient prepare for liposuction?
Realistically, there's really nothing to prepare for. Most of the patients that I see for liposuction are those patients that I just talked about. They're in good health, they have good eating habits, They exercise, not every day, but certain times of the week. So I think that whatever is your normal daily activity, your normal eating habits, I want you to continue doing those. I don't want somebody coming in trying to lose 20 pounds before they get their liposuction, or on the other hand, go on an eating binge. You don't have to exercise more often than you normally would. Just come as you are, that same way that I see you in consultation, and you'll be ready for your surgery.
What areas can liposuction target?
Well, the nice thing about liposuction is it's extremely versatile. You can hit anywhere from face all the way down to the ankles. So in the face, some of the most common areas right now is just under the chin. This area here that we get, that's got that double chin, that's a very common area and is very amenable to liposuction. The other areas are a little bit of the jowling. I do a lot of liposuction in this area when I do facelifts and kind of thin this area down. As we move down, obviously upper arms are a big source of, or a big area for liposuction. The chest, the back, the abdomen, the hips, inside and outside of your thighs are also common areas. Even on the calves and ankles are becoming more popular. The areas that are you sort of have to really kind of watch are the front of the thighs, the back of the thighs, and also the buttocks. I know today the trend is to actually add fat to buttocks to give a better shape or to get a little bit better size. But for times, patients will come in wanting to thin that area down. Those are three areas that are sort of unforgiving. And what I mean by that is you have a higher risk of increasing a person's cellulite in that area and also adding or creating some contour deformities. So the front of the legs, the back of the legs, and the buttocks I usually stay away from.
You mentioned liposuction under the chin. What's the difference in results between liposuction and Cabella, the new injectable that we're using under the chin?
It's a good question. It's a common one as well. Cabella has come out over the last couple of years. It's now owned by Allergan. It's a solution. It's basically a chemical that you can inject in this area. It takes a series of about 15 to 20 injections at one time. The solution that we inject actually dissolves fat, and there has been some very good results with it. So it is an area that I offer. It's a modality that I offer along with liposuction. So both of them are good procedures. The difference, though, is that Cabella came about because there are certain people who don't want to have surgery. So, and this is an alternative to that. Think about liposuction as a sort of one-and-done procedure. You get a very small incision just under your chin, about 3 to 4 millimeters. It's about a half an hour, 45-minute surgery. Sometimes it can be done under sedation, other times general anesthesia. It just depends on what we discussed at the consultation. After that, it's an outpatient procedure. I usually have patients back to work in about 2 to 3 days, exercising within the first week. There's a very little bruising, maybe a little bit of swelling with it. Cabella, on the other hand, again, can be done in the outpatient setting, so meaning you can have it done in an office setting. You don't have to go to the operating room. It takes about 20 to 30 minutes to do. You get about 2 to 3 days of swelling that eventually goes away over the next couple of weeks. You might have a little bit of bruising, very little pain associated with it. Very little downtime. Again, a couple of days of not working out. The difference of that is, though, you have to do that at least 2 to 4 times, and you have to do them about 6 weeks apart. So if you're looking for a more, I guess, a quicker result, then liposuction would be your best bet. If you want to go the other route where you don't mind waiting 3, 4, 5 months for your final result, and you don't want to go to the operating room, then Cabella is not a bad solution. Cost-wise, when you start getting up into 3 or 4 treatments like Cabella, it really runs about the same amount of cost as one liposuction procedure.
Can liposuction be performed with other surgical procedures? Is it a common?
Yeah, it's common to double up liposuction. Lots of people would come in and talk about doing it on their bellies when they get a tummy tuck. There are certain areas of the abdomen when you're doing a tummy tuck that you can still liposuction, like the hips or the upper back. Breasts and arms, when you're doing an augmentation or a reduction or a breast lift and doing liposuction of the arms, is a very common procedure or a combination procedure. back and arms. Sometimes patients will come in and we'll do a series of arms, liposuction of the arms, liposuction of the legs, liposuction of the abdomen. So you can double up different limbs or different areas as well as different types of procedures with liposuction. It's just that versatile.
What does recovery look like with the procedure?
Liposuction is probably the quickest recovery of any surgeries that plastic surgeons do because the incisions are tiny. Again, the incisions are like 3 to 4 millimeters in length. I usually have patients in compression garments, and I have you wear them strictly right after surgery for the first 4 to 5 days, and then I see you back in the office. Once I take the dressings down, you can shower, you can start working out at that time, usually light things. By 2 weeks, you're back to all working out, anything that you want to do. I have patients probably refrain from going to work for about the first couple of days, and then you can get back to work. So quick recovery, quick back to all of your daily activities and exercising.
Is liposuction permanent?
That's a good question because there's some myths about that, so we'll just touch on them right now. Yes, liposuction is permanent. The reason for that is you're actually physically removing fat cells. Once they go in that fat canister, it gets discarded, so it's not going to come back. There's a myth out there that I hear questions or comments all the time. My aunt had liposuction in her abdomen, and then her legs got bigger. That fat is gone. It's out of your body. It doesn't find its way back. There's not other fat cells in the body that will sort of compensate for that and get bigger. This is a contouring procedure. So think of it as taking fat out of one compartment so that you're better contoured, so that you look more balanced. Now, this doesn't prevent you from gaining or losing weight in the future. You can continue to lose weight as you normally would. However, if you gain weight, then you gain weight more uniformly. If you're somebody who carries more weight in your love handles, when you gain weight, that's the first place you see it. Once that area gets liposuction and contoured, if you gain weight, you won't see it there right away. You'll see it uniformly, across the rest of your body. So it is permanent. The other fat cells, and remember, we're not removing all of the fat in that area. You're just contouring it down. So the other fat cells in the area, if you gain weight, can get larger.
Does liposuction look the same for everybody?
That's a hard question because everybody's an individual. So I want to say, and I hope that this is answering the question, but it doesn't look the same in everybody because everybody's different. Every body is different, and some people need it more in the arms or the hips or the thighs. So depending upon your body habitus, if you're somebody who is very lean but has a genetic predisposition for, say, liposuction or a fatty deposit on the outside of your thighs, and a lot of ladies have that, and you know what I'm talking about. You're very lean everywhere else, you just have this genetic capacity for carrying weight in that area. So if I liposuction you there, you're going to certainly look different than somebody who needs more liposuction in the hips or the waist. So the goal is, for me as the surgeon, and I would imagine for all of my colleagues, is using the liposuction cannula to create a balance for your body, not comparing you to somebody else.
How would I go about making an appointment for this procedure?
Well, that's the easy thing to do. The easiest way, or one of the easy ways, is you can call the office directly. It's 844-496-6647 is my office number. And that goes to either my office in Pittsburgh or my satellite office in Monroeville. The other thing you can do is you can visit the website, bellissimoplasticsurgery.com. And two ways of going about it there. Number one, that has all the information again about the phone number. But we also have a portal that under the contact tab. There's a portal that allows you as a patient to contact me directly. You can upload some photos. You can do almost a virtual consultation with me at that time. You can put in the questions that you have or the concerns that you have. You can upload photos. You can send it to me directly. The great thing about it is it's HIPAA protected. No one else gets to see it but me. I can look at your photographs. I can comment back to you saying I need more information or just tell you what I think. And that's another way to do it. And then you can, what I will do at that point, if you want, is that I'll have one of my patient care coordinators, either Rose or Chanel, contact you, and then they can set up an appointment with you at your convenience.
That's all the questions I have. Did you want to?
Well, I just want to thank everybody for tuning in. This was kind of fun for me. So just remember that BellissimoPlasticSurgery.com if you have any other questions or you want to find out other information. There's also photographs of before and afters on there.
We have 2 questions that have come in.
Mhm.
The first one is, with liposuction, are you able to do multiple areas at the same time, which you briefly touched upon?
Yeah, and like I said, it's very common, especially hips and abdomen. So lots of both men and women. This is a procedure that for both men and women, it's still more common in women, but it's rising rapidly in men. So hips and abdomen, I've done hips, abdomen, thighs. We can do the pockets be underneath the armpits. There's another area that ladies really get frustrated with is when you're carrying a little bit of fat right in the front part of your armpit. And that's another area that is amenable to liposuction. But all of this can be set up to do all at once, so you can get all of your liposuction done at one time.
And the second question is, liposuction to the upper arm usually sufficient, or is a lift required as well?
Again, that's something I would have to see you and evaluate you for, because what you're looking for is how much fatty tissue do you have, what's the tone of the skin, how much elastic principles does the skin still have in the thick part of the under part of the skin called the dermis. The thicker the skin, the more likely that skin is going to, again, what we talked about is kind of stretch back and form and not be sagging. If you're somebody who's lost a lot of weight and you also have some stretched out skin, I would probably do the liposuction first, and then as a second stage, come back, bring you back, and take out the extra skin. But for most people, normal weight individuals who are just carrying some extra fatty tissue in the upper arms, liposuction is sufficient to recontour after the fat's removed.
Terry left a comment that says, great video, best procedure I did with Dr. Antimarino.
Terry, thank you so much. I appreciate it. It's been a while, so stop in and get reacquainted.